we really encourage you to get formal legal advice. We have confidence in the accuracy of everything we're going to share with you today, but these are very fact-specific questions. And we frequently, as recently as yesterday, reached out to the Department of Health and Human Resources, which is an excellent resource, to respond to some questions on behalf of clients regarding the COVID workplace rules. So please don't treat this as formal legal advice. Please do ensure that you go to your attorney in order to get formal legal advice. But we are confident and hopeful that what we're going to share with you today is going to be useful. So let's try to deal with Ryan's question, a question that many of you have presented to him through the use of a hypothetical. Let's assume that you have an employee whose child has gone to Myrtle Beach for a vacation. And upon returning from that vacation, the child develops symptoms of COVID on a Monday. On Wednesday, that child is tested for the virus, and on Friday, the test results come back positive. The employee has no symptoms of the virus, but he has resided with and he cared for his child who remains at home. Can that employee safely report to work on the following Monday? So our inquiry begins with determining whether an employee has been in close contact, as that term is defined, with a person diagnosed with the virus. Close contact is defined by the Centers for Disease Control, the CDC, as being within 6 feet of an individual diagnosed with the virus for over 15 minutes. The West Virginia Department of Health and Human Resources has a broader definition of what close contact is. In West Virginia, you have been in close contact with an individual diagnosed with the virus if, one, you live in the same household with that person, two, you are caring for a person with the virus, three, you have been within 6 feet of someone with the virus for 10 minutes or longer, or four, you have been in direct contact with the secretions of someone with the virus. So in our hypothetical, the employee plainly has been in close contact with the person diagnosed with the virus. And while the employee may not have gone on vacation with his child, and the employee may have no symptoms of the infection, they do live in the same household as a person who has tested positive for the virus. They have cared for that person. They likely have been within 6 feet of that person for 10 minutes or more. And they likely have had some contact, some direct contact with the secretions of that person. So if an employee has been in close contact with a person with the virus, they should not be permitted to work under the guidance issued by the West Virginia Department of Health and Resources and CDC. So then the question becomes, when can they return to work? The West Virginia DHHS advises that all employees, individuals who have been in close contact to a confirmed COVID-19 case, they recommend that that individual self-isolates for at least 14 days from their last close contact to that person, a 14-day period since their last close contact. If the employee here returns to work on Monday and discloses that his child is COVID confirmed, they should be required to self-isolate and certainly not report to work for a minimum of 14 days. Also, the DHHS recommends that close contacts, individuals who have been in close contact with a confirmed case, should be tested. Under the Families First COVID Response Act, that's the federal statute, the first one that was passed, that person may likely elect to take emergency paid sick leave as a state quarantine order requires self-isolation for that employee. If the employee develops COVID-19 themselves, they should not be permitted to return to work until they test negative for the virus or 10 days after they first exhibited symptoms and 3 days after they last had symptoms of the virus. If the employee never develops symptoms of the virus, the employee may return to work after that 14-day self-isolation period. Or if you have a policy requiring a negative test result, then upon receiving a negative test result and remaining off work in self-isolation for that 14-day period after both, depending on whether or not you have a policy prohibiting an employee from returning to work until they have received a negative test. And remember that the West Virginia agency recommends testing of an individual who has been COVID confirmed. Now, as an employer, you may request your local health department, your county health department, to release an employee from isolation. Essentially, it is a form that indicates that an employee is safe to return to the workplace. And it's a responsibility of local health departments to issue such a notice. That's something you may want to consider. And you may want to consider all of this information in specific terms of, do I have a policy? Should I have a policy? And what should that policy say? So we at Dinsmore strongly recommend employers to develop a COVID-19 related policy that identifies what types of return to work processes will be in place. Please remember that if your employees are represented by a labor organization, you likely have a duty to provide notice to the union and an opportunity to negotiate with regard to the terms and conditions that are established in that policy. If your employees are not represented by a labor organization, that should not be a concern. But the primary issue here is that without a policy, employees don't have any appreciation for the types of behaviors that they should anticipate in the event they go on vacation, in the event they come in close contact with an individual who has tested positive for the virus. And at the base of all of this is the health and safety of your workforce, which is critical not only to the safe and efficient operation of your business, but also, and more fundamentally, your obligation to provide a safe workplace for your employees. Now, Brian has shared with us that there are also some other questions that have been recurring. And I know that some of you will have questions and we want to address them. But before we get to the question and answer period, I'd ask Brian to give Haley Geiler an opportunity to address some of those other issues that have been of concern to you. Brian?
Well, thank you, Mark. That's most helpful, and we really appreciate that summary. Haley, absolutely would love to go ahead and hear from you what you wanted to cover today as well before we get to the Q&A part.
Absolutely. One caveat to what Mark just said, just remember for those employers that are healthcare providers and that fall under the critical infrastructure guidance for the CDC, you do not have to follow the 14-day exposure policy as clearly as some of the other employers do. There's more flexibility for those employers since they are critical. But that guidance is from the CDC, and I spoke to the West Virginia Department of Health and Human Services this morning, actually, and they did confirm that for those employers that meet those definitions as critical or healthcare providers, they're still following the CDC guidance to let those employees return to work a little quicker because we know that they are essential during this time. There's been a lot of questions recently, very good questions as we move along in this process and as COVID develops, as we know there would be. And so one of the big questions we're seeing right now is about employees that go on vacation. Now that almost everywhere is surging, and we're likely to see that continue. We do have concerns that those employees might be returning from hotspots or traveling through hotspots or gaining exposure during those vacations. So one of the questions that we're hearing from employers is, what can we do about this? Can we make a policy? What do we define as a hotspot? How do we define if they traveled to there? All are excellent questions. Unfortunately, at this point, a lot of this is employer discretion. Employers are absolutely permitted to make policies related to vacations and if employees can return to work after traveling to hotspots. As you all know, defining a hotspot is difficult to do at this point. It's also difficult because it's ever changing, but you can certainly try to do that if you feel comfortable doing it based on state or based on certain cities or based on the amount of cases in a certain area. That's all perfect ways to define that. The CDC is still defining cruise ships as very high risk. So any of your employees that are going on cruise ships, you could consider not letting them in. You could consider making those restrictions based on type of travel, whether that be airplane or bus or train, whatever you decide based on CDC guidance is the most risk likely. And the CDC does have guidance on those issues, but when crafting those policies, we need to make sure that we're being consistent. So we'd really encourage you to do a written policy just to make sure that it's applied consistently, non-discriminatorily. One of the things that we were concerned about, a little less so now, is you can't ban certain international destinations unless there's some kind of rational relation to the risk of those destinations. For example, if you wanted to ban the Czech Republic, but they don't really have any high cases there, that might lead to a national origin type of claim. Clearly, this is a little less of a risk now that most of the world is not letting the U.S. travel to those destinations as we are the new hotspot, but that's something you want to consider. You also want to make sure that you're considering any exceptions that would need to be made for religion or disability if someone needs to go out of state for treatment for something, or if there's some kind of religious ceremony. That necessarily doesn't mean you have to exempt them from the policy, but just make sure that when those policies are crafted, those considerations are there. Make sure that you think through, does it matter if they actually stopped in a destination or if they just drove through it? Driving through something in theory has pretty little risk unless you stop, get gas, something to that extent. Clearly flying through those destinations could lead to a higher risk and is something you all may want to consider when drafting those policies, but there's a lot of discretion here as long as it's applied uniformly and there's some kind of rational relation to those destinations that you are declaring as hotspots. It's perfectly fine to make those policies, and it's fine to make policies about whether that leave is paid or unpaid when they return, keeping in mind the FFCRA, keeping in mind any kind of paid sick leave law or any collective bargaining agreement that you have when making those policies. Just make sure that those are compliant as well. The next question that we're seeing is to do with these temperature screenings or due to symptom screenings. There's a lot of questions about if you have to do that and the methods for doing that. At this point, it's highly recommended that you all consider putting those procedures in place in your workplaces. OSHA is recommending them. They think it is a valuable tool for weeding out potential, at least symptomatic individuals. West Virginia, in their industry-specific guidance, has those screening recommendations in each of its guidance. It's also important to note that the CDC recommends it, and other neighboring states such as Ohio and Kentucky are actually requiring it in their guidance. So it's certainly something that employers should consider implementing. As of now, we've seen a couple ways of implementing those. You can either have a true screening where someone comes in and another employee goes through a checklist with them or asks them questions, and they have to identify whether or not one of those conditions applies to them, or an actual temperature screening, as you all have probably experienced in at least one place now. Some employers and some companies are requiring screening checks before anyone can enter, including employees. That's certainly a very safe option to do as long as it's implemented appropriately with the proper confidentiality guards in place. Something else that we're seeing is some kind of electronic checklist, essentially, that says that the employee has reviewed their symptoms, has reviewed their temperature, and does not have exposure. Those are being done in different ways. A couple restaurant clients that I have seen have actually apps that employees use to check in and check out, and they have to mark on those apps that they have gone through the screening and that they don't have any of the risk factors apply to them before then they can enter the job or their workplace. That certainly is a way to make sure that you have proof and reporting if that's ever checked by OSHA or any other kind of investigation to prove that you've been doing those screenings. I've also seen different employers, like our firm has what is essentially a screening checklist on the desktop screen of every employee. When they come into the workplace, they have to log on via that screen before they can access their laptop or their computer. And so that's a way of assuring that the employees have seen the warning, have seen the screening warnings, and have indicated that they will not come to the workplace if they have one of those risk factors. I have seen an alternative option, which is a little less secure, and we probably wouldn't recommend, which is just having the notices posting and screening factors posting and requiring the employees to self-identify if they fall with any of those groups. That's going to be hard to ensure compliance if it ever comes up in investigation, which is why it's a little less secure, but it's certainly a better option than no option at all. The next question that we're seeing, which sort of ties into the other two questions, is, well, what do we do if the employees either aren't identifying a risk factor or are lying about a risk factor? For example, an employee who goes on a vacation to Florida and who doesn't report it when they are supposed to do so, or an employee who reports they don't have a fever when in fact they do have a fever because they don't want to be placed out of work. And the way that we would treat that is a violation of a policy, which is another good reason to have a written policy. Most of these written policies in your handbooks should have a dishonesty provision or some kind of integrity provision. They should also have a safety provision, which we would consider violations of those policies safety violations, since providing accurate information is essential to that safety policy working efficiently and effectively. So that can be another way that it can be considered a violation of a safety policy, and then it can be used as a disciplinary action from there. Clearly, you still need to follow whatever disciplinary policy you have. If you have a progressive disciplinary policy that requires you to work in steps, you should certainly still follow those steps. But if you would normally terminate an employee for dishonesty or for violating a safety policy, you could include, those up to and including termination as a form of discipline for employees that are dishonest about these safety factors or otherwise violate the policy if they take other steps to avoid, the safety precautions that they're supposed to. At some point, discipline will need to be done. You can start with something as low level as oral counseling or written counseling, but we do need to make sure that employees are truthful in these because it's the only way that we can ensure that the policies and the procedures are effective. There's been a couple other updates that we just wanted to fill you in on since our last meeting together. As you all know, this situation evolves very quickly and the guidance changes frequently, if not constantly. So we really recommend that if you guys haven't already, that whoever is in charge of your COVID response team sign up for alerts from relevant agencies, industry groups, and law firms. I sign up for them all. I think they're very helpful and it makes sure that nothing slips through the cracks. Groups like the West Virginia Chamber of Commerce put out wonderful information to their members and alerts to their members, and that can keep you up to date on what's going on. The U.S. Department of Labor also has a feature where you can sign up for alerts and notifications if there's new guidance issued or new regulations or changes to the law or changes to the guidance. You just put in your email and select which sorts of alerts you are interested in, and they'll provide it to you completely free of charge. There are also many law firms that put out alerts like these. Our law firm has one. In fact, we have an entire COVID page that talks about everything from different webinar links, FAQs for frequently asked questions about every field and type of COVID-related question, charts, checklists, guides, and updates. You can sign up for general COVID updates or industry-specific updates, but they're really helpful. They're emailed to you whenever they come out, completely free of charge. There's no strings attached to any of these. So we highly recommend that you have someone for your team sign up for these alerts, just because it can be so hard to monitor all of the potential news sources for authority. So highly encourage that you guys do that, or someone on your team is registered for those and monitoring those so that we can make sure that we're kept up to date. I did want to note a couple other things. Last week, OSHA announced and published some FAQs on COVID-19 and the workplace, and they primarily summarized the guidance they already had on reopening workplaces, but they are now more formally encouraging use of face masks at all times in workplaces, unless some kind of safety exception applies or there's some kind of medical condition at play. So that's something to keep in mind. OSHA is likely to become more adamant on those, and I highly encourage you all to take those seriously. I have seen more OSHA complaints on COVID in the last 3 months than I saw all of last year. So this is something that people are filing complaints about, and it's something that OSHA and the state OSHA agencies are investigating pretty actively. The CDC also announced new opinion yesterday via the CDC director that was stating that it encourages all individuals to wear masks when in community settings. This is stronger language than they've used previously, which is in line with the states and the localities also encouraging uses of face masks, if not requiring them. Another interesting thing of note is the DOL released guidance on FFCRA, the Families First Coronavirus Response Act, defining more specifically if you're entitled to FFCRA leave because your child's summer camp was closed. They released a pretty specific opinion letter on that, and we can go through that if you guys have any questions. Happy to answer a little more specifically about that. But if that's a question that's come up in your workplace, the DOL just released new guidance on that, which would be a helpful tool. From a West Virginia specific perspective, as you all know, on July 7th, an Executive Order 50-20 went into effect, which required all individuals over the age of 9 to wear a facial covering when in a confined indoor space other than their residence or when eating and drinking, and when they're not able to adequately socially distance from other people in their households or from other people in different households. It doesn't apply to people who have issues breathing or are unable to remove the facial covering without assistance, but it is something that employers need to make sure are being actively enforced, or there's potential citations from the health department and even potential citations from OSHA. You all probably heard as well that yesterday the governor announced that there would be an executive order regarding gatherings of 25 or more people. There are exceptions for business and entities that have an event that have been deemed essential, which is defined by the previous executive order 9-20. The order is not available online as of about 20 minutes ago, but it's likely to come out today, so keep an eye on that. And of course, as Mark mentioned, the bars have been closed in Monongalia County for 10 days. We expect that order to come out as well. Hopefully we're not trending towards a whole nother shutdown, but I think it's likely if things continue to surge, certain industries, we might see that. So those are the most recent updates we just wanted to keep you guys aware of, and the most frequently asked questions that we wanted to address, and we're happy to answer any additional questions you have a little more in depth. But we did want to give you an overview of what had changed since our last session and just some answers to some of those more frequently asked questions.
Haley, thank you so much. Mark and Haley both, if it's all right with you, we'll go ahead and move into the Q&A section.
Please do.
Okay, so just for everyone listening to this call, when we get into the Q&A section, there are a couple different ways, and we can take questions for a good while. We will have a hard stop close to about 10:30 today if we go that long, so we will try to answer as many questions as possible. There are a couple ways for you to go ahead and ask questions. You can go ahead and put them in the Q&A box or the chat box, or if you want, there's a button for you to go ahead and raise your hand. So I will go through, if you raise your hand, and go ahead and basically allow you to talk, and it'll give you an option to unmute. And then you can ask your question live to Mark and Haley, and they can go ahead and give it an answer to. So we'll go ahead at this point. If anyone wants to go ahead and start asking questions, raise your hands. I see one right now. I also see one in the Q&A. Let me get back to that. Okay, we have a question from John Fuller. John, just make sure you unmute yourself and ask away.
Thank you very much. I have a question regarding temperature screening. If I wanted to implement a temperature screening protocol in our place of employment, where would I find guidance or advice about how to protect the person actually doing the screening, and also how I would ensure that confidentiality was maintained? Are there any special considerations or concerns I should have around who did it, how results were recorded, et cetera, to make sure that the actual temperature screening itself was done in the appropriate confidential way? And keeping in mind the safety of the person handling a thermometer, et cetera?
Yeah, that's a great question. Haley, let me take a first crack, and then please fill in if you have anything else to add. But John, that's a great question. Certainly, you can implement a policy that requires temperature screenings. And the question regarding the safety of the individual who is taking the employee's temperature is a very valid one, because obviously you don't want to expose that individual to potential contraction of the virus or close contact with someone who is positive. So the option that is being used by most employers is the use of a thermometer that doesn't actually require direct contact between the individual taking the temperature and the individual whose temperature is being taken. It looks like a little scanner. They're available from multiple different distributors, and they are generally accurate at 6 feet. So I would encourage you to consider using that type of device for taking an employee's temperature. Now, if you record the employee's temperature, it's important to realize that's personal health information. And therefore, you are literally under the restrictions of HIPAA in that kind of circumstance. And any records that are created must be kept confidential under HIPAA. And beyond that, under the Americans with Disabilities Act, you are required to maintain those records, if you choose to, in a separate file from the employee's ordinary personnel file within a health-related file. And hopefully you already have that system in place. That's been the law since 1992. But if you do keep that medical information, that health information, then you're required to keep it in a separate file. Haley, any other thoughts on that question?
Yeah, it's a great question. It's something that we've seen a lot of people struggle with, but there is specific guidance on this available and the OSHA FAQs, I believe, that talk about the different procedures that you can put into place that keep employees who are taking the temperature screenings and also those whose temperature screenings are being taken safe. They're encouraging use of face masks, clearly, but to the extent you could use a face shield, you have gloves, you have, some kind of cover, whether that be one of the actual medical grade. They're not vests so much as they are aprons, but those are all great. You can also have the person stand behind some kind of blocking mechanism. Those are primarily what you're seeing as those plastic or glass coverings. That can be a great safe way to make sure that those people have safe social distance. Like Mark said, the touchless thermometer is by far the most recommended. The absolute worst thing that you could do is have them taking their temperatures in their mouths and then you having to clean those and recycle those. That could actually spread the respiratory droplets and make things much, much worse. So to the extent you can, definitely use the contactless thermometer. Those are all great. And then from the perspective of actually recording results, the more medical type information you keep, the more that's privileged, for lack of a better word, under the ADA. So what we're encouraging people to do is not so much record their actual temperature, so much as just mark whether they are or aren't over that 100.00 temperature threshold that the CDC has set. And so that looks, for most of our employers, like a checklist that essentially says, did the employee have a temperature of over blank? And then those records, if you choose to write them down, are kept confidentially as the ADA requires, which means it probably needs to be kept in a secured electronic file that other employees can't access, or the written records need to be kept in a locked drawer in a personal office that most of the employees can't access. As to who's the best person to conduct those screenings, I've seen it done a couple ways. Either reception or security, depending on what your facility looks like, should be trained on the steps and the mechanisms and the safety mechanisms for making sure everything is safe in that process, and they can do it, or you can have that as a function that's assigned to HR. We've seen it both ways. Some of it's just up to whatever makes the most sense for your facility and your layout and your comfort level with which employee does it.
Thank you both. We have gotten a couple questions that have come into the chat. So the first one is actually for two questions. I'm going to combine them because they're so close. So the first part of it is it generally recommended by OSHA and the health department that employees wear face masks, for example, in an office space or where employees work within 6 feet of each other? And then the second question that ties in is how can an employer enforce the wearing of masks for those who refuse? And what is their option to remove them from the facility if they refuse?
The answer is yes. Haley, you want to explain why?
Yes. OSHA specifically is recommending very strongly at this point that face masks are used, cloth face masks are used as a method of abatement to prevent the spread of the virus. Like I said, the Department of Health and Human Services is also strongly recommending that that's used. I think if that is not being enforced, we're likely to see that become a requirement. The executive order to some extent does make that a requirement depending on the circumstances. And so that's something that needs to be strongly introduced in your workplace if it isn't already. Is always faced with initial backlash from the employees. They certainly hate it. We've seen this question from all employees, is what to do if it's not being properly utilized. I think that depends on the reason it's not being utilized. If this is somebody with a medical condition where they have issues breathing, or some extent where they're not getting enough oxygen in, that's certainly one issue that probably needs to be dealt with via the ADA accommodation process. And those inquiries should probably be directed towards HR or your COVID task force team. And so exceptions can be made as necessary. The other thing you should probably think about is religious exceptions. We haven't seen those come up so much, but in some cultures, they do wear facial coverings already. I don't think it's necessary to make them layer it, but there might need to be some kind of religious accommodation you may need to consider. There's also, of course, safety exceptions. As certain industries will already know, there are requirements that certain types of masks are used or certain fits of masks are used for safety purposes, or there are certain industries where it's so hot or they get wet where the face masks actually become more dangerous than they do become helpful. Those are normally limited circumstances, but it's certainly something if you feel that your industry or your workplace would be an exception, I strongly recommend you reach out to legal counsel. You guys talk that through because it is so fact specific, but those exceptions certainly do occur. But if the employees just refuse to wear them and that's your policy and they don't fit sort of one of those exceptions, then I think you need to start the disciplinary process, whether you want to start low with an oral counseling or you want to issue written counseling and work your way up. That's certainly something that then you need to proceed. If you feel so strongly about it, you will actually remove them from the workplace. That's something you certainly can do. It needs to be cautious how that's done. We certainly don't want to end up with some kind of battery charge or something like that. We just recommend that if they refuse to wear it, you issue whatever discipline level you think is appropriate and you can ask them to leave. Certainly have some on hand, if only the disposable kind, to provide to employees who don't have a face mask. It's certainly better to start that conversation from the standpoint of, this is our policy. Do you need us to provide you a mask? And then have that conversation just so that the employees that forget their face masks aren't being punished. We do want to be congenial about this because we do know that the employees are a little hesitant to comply already.
Let me add two quick follow-ups on that if I can. Number one, this all goes back to, could go back to the interactive dialogue requirement under the Americans with Disabilities Act. But employees refusing to wear a face mask, and it's your policy that all employees must wear face masks, then the important question is why. And it is very useful to engage the employee in order to determine what the reason for it is. As Haley mentioned, there could be an underlying health concern like COPD or some difficulty breathing, and some type of accommodation may be easy, simple, and in both parties' best interest. So it's very, very important to learn why. The second thing is, and I want to stress this again, you want to ensure that if you do mete out discipline, it's consistent with your current policy. And if you're in an organized workplace, meaning a union represents the employees, those, you likely have a collective bargaining agreement, and those bargaining agreements very frequently have some type of graduated discipline that is required under the contract. So you want to ensure that you're in compliance with your collective bargaining agreement as well. But if you set up a policy requiring the use of face masks and employees define that policy and putting other employees at risk, you certainly may discipline up to and including termination if that's what's necessary. Brian?
Thank you. Our next question, if an employee comes back from vacation from a hotspot, do they get paid during quarantine and testing period? And if so, how?
Well, this has been a source of debate in our shop. And frankly, it's one of the issues that we have, we covered in some detail on June 25th. There is a potential that if the employer's policy requires an employee to remain off the job and seek a COVID negative response, that they could potentially qualify for the emergency paid sick leave under the Families First Corona Response Act, the FFCRA. The FFCRA requires specifically that an employee have symptoms of COVID and is awaiting the results of a diagnostic test in order to qualify for emergency paid sick leave. However, that presents a difficult problem for employers. If the employee requests sick leave and the employer refuses it, and the employee later realizes they did have symptoms of COVID, or most unfortunately, if they actually develop COVID and it's a positive test, then that period where they're waiting for the diagnostic results could have required the employer to provide emergency paid sick leave or sick leave benefits. So that is a tough question. That remains a gray area. That would require some discussion, in our view, with your counsel on how much tolerance you have for risk and how you want to treat your employees. Some employers whom we represent desire to ensure that employees have the option to elect to take sick leave or pay for the period within which they are awaiting a COVID negative test after they return to work from vacation. Others don't want to do that. Could they be liable? Yes. Will they be liable? Unfortunately, we just don't know yet, unless something's happened in the last week. Haley, are you aware of anything?
No, the DOL has been pretty quiet on that issue. There are a couple other concerns I want to highlight here. One, there is a difference between, as you all know, under the FLSA, between a salaried exempt employee and a non-exempt hourly employee. Or I'm sorry, non-exempt employee. Sorry, got the terms confused there for a second. But for those salaried employees that are salaried exempt, if they work during the work week, they are entitled for their full week's pay unless one of several exclusions occur. One of that is FMLA leave, which is commonly used. Another is if they are taking paid leave based on a policy or procedure that's already established. But for the most part, just remember, if it's a salaried employer, you really need to contact legal counsel or your HR specialist to determine if they are entitled to payment for that week, because they are sort of a separate issue than the hourly employees. Mark already highlighted the FFCRA considerations, so I won't hit on those again. Paid sick leave is also something you all might want to consider. Those statutes don't really exist so much in West Virginia as we see them in other states and localities. But for those of you that have out-of-state facilities that are operating where paid sick leave might be a requirement under the law, some of those localities and states have expanded those laws to include situations such as those where the employer will not let them work until there's no exposure. So just make sure that you comply with those. As Mark and I have both hit on, if you are a collective bargaining employer and you have an agreement, you certainly need to make sure that whatever you're doing is is compliant with the CBA, but also you may have to bargain on those as well. Otherwise, hourly employees aren't generally entitled to pay for time that they do not actually work. We're certainly seeing a lot of employers offering to let them use any PTO they have available to cover that time. We've also seen some just opt to cover that time for them, and then we've also seen some people opt to have that time unpaid. But like I said, if this issue comes up and you need additional guidance on that, seek legal counsel, because the FLSA can be a little bit hard to understand even in the best of times, and right now that's increasingly true.
Well, thank you. Our next question that we have in would relate, are employers required to notify other employees if there's a positive COVID test in the workplace? So for an example, let's say there's a contractor, they know there's a positive case, but they have not notified other employees on the job site, and there's been no attempts made at contact tracing. Does the employer need to let everybody know essentially that there has been a positive COVID test?
Haley?
Yes. So OSHA and the CDC is recommending it. The DHHR is also saying employers should do it. I haven't seen anything out of West Virginia saying it's required as of yet, but it is recommended that employers do inform that at least those that were in close contact, as Mark defined it earlier, are notified of their potential exposure, just so they have the opportunity to get tested and that they're self-monitoring. And to the extent they have been in close contact, it's essential to let them know that they need to self-quarantine under the DHHR's guidance as well. But as you're doing that, you need to keep in mind the ADA. You cannot identify the individual who has COVID-19. Those notifications need to be a little more subtle. They need to be probably made by someone in management who has experience with the ADA or HR, and they just need to let the employee know that they have been potentially exposed or in close contact if they actually have been in close contact, so that the employees self-monitor. We're also seeing some clients just going ahead and alerting all employees if there is a positive case in their facility, just for transparency. That's fine as long as the employee is not identified when they do that. But certainly if someone was in close contact and they're not aware that they were in close contact, we would encourage that you notify those employees just so they know that they should probably get tested, and more importantly, that they need to self-quarantine.
Excellent. Our next question is, what's the best practice if an employee at the screening process communicates that they have one of the symptoms of COVID-19? Should they immediately be put into quarantine for a while, or are they able to go and test negative or get a doctor's release? Basically, should it be a call from a health department or a doctor, or should that employee be mandated to quarantine? And I think the reason for this question is, especially with allergy season, things going around, you can have symptoms similar to COVID that aren't, but what happens if that person comes in contact with the screening station?
That's a great question. So I'm going to take this from the standpoint that you've identified this as part of your screening procedure, or that they've called you and notified you in advance that they're experiencing COVID-like symptoms. So certainly if they're already at the work site, they should be respectfully, sort of asked to stand aside and outside of the screening process, and let them know that, that is a COVID symptom and that currently they're not permitted to enter the workplace. And before that they're allowed to enter, they need to contact HR, whoever is your point of contact, just so HR can have those conversations with them. So basically what you tell them is you say, thank you, you've been triggered as somebody that, might be displaying COVID symptom. Due to our health and safety precautions, we're going to ask you to go home and to reach out to HR and let them know of this screening result, and they'll talk you through next steps. That's a way to sort of immediately handle the situation, and then HR has the time to figure out a little more in depth what's going on. One, if they've had potential exposure, and two, to give them next steps on if you're gonna let them come back to work. Just because they have a symptom doesn't mean they have COVID, and if they test negative, after the prescribed amount of time, they are allowed to return to work. assuming they don't have a fever and, they test negative and those other things. So I would have them, the people that are handling those screenings, respectfully ask them to go home and to contact HR and talk through next steps. And then HR can handle that on a more case-by-case basis after they have a little more information, and possibly they have a note from the doctor saying whether it's safe or not for that employee to return.
Thank you, Haley. The next question we have is, it relates to the screening process. And the question is, will having an employee self-identify that their temperature is below the appropriate number through a daily questionnaire, is that an appropriate way to handle the temperature issue, or should the employer also have a screening themselves?
And I think we've addressed this one a bit earlier, but it is certainly an acceptable way to treat that question, is to ask an employee to self-identify whether or not they have had a temperature in excess of 100.4 degrees within the last 24 hours, and to rely upon that, although it is much safer to actually administer a temperature test, to take the employee's temperature as part of your screening process, because the employee could misrepresent it. B, the employee may not have a thermometer at home or one that works, and that creates a situation where you could be exposing your employees to an individual who certainly could put them at risk, and doing so is entirely unintentional. Haley, are you aware of any guidance on that?
Not within West Virginia specific. I think that's right. If you have the screening question and you rely on employees to self-report, I think that's adequate to meet the guidelines in West Virginia and from the CDC. If you want to be a little more safe and you want to make sure that you have the results and that someone can see them and verify that, I think it's certainly slightly safer to do it that way. But I think that having them self-report their temperature is sufficient, as long as you give them advance notice that they need to be doing that before they go through the screening.
Thank you. So our next question goes back earlier to Mark, an example you gave about if an employee's child or spouse tests positive and that employee has to go into self-quarantining. What about the coworkers of that employee? Would they also need a quarantine? I guess, would that also make a difference between if the employee tested positive and tested negative, and how's that play out?
That's a great question, and we actually just got an answer from the state of West Virginia on that. If you have had close contact with another close contact who has not been diagnosed as COVID positive, then there are no requirements on the employer to in any way restrict those second, in the law we call it hearsay. An individual who has not had close contact with a confirmed COVID case. So in the scenario that was just presented, Brian, there would not be any requirements to place any higher restrictions or screening on the individuals who may have had close contact with another close contact. The key is, has an employee had close contact with an actual COVID diagnosed individual? I hope that made sense.
Yes, I think it's essentially close contacts of close contacts is how I understood it.
That's correct.
Thank you. The next question we have, and so far it's the last question that is still out there, is if everyone is wearing a mask, can the number of persons in an area be larger than 25?
Well, under the governor's very recent declaration, and please know we don't have the actual executive order yet. So we don't, as they say, sometimes the devil is in the details. But unless they are in an essential function, and that term appears to be fairly broadly defined. So for example, attending religious services is considered an essential function per the governor's office yesterday. And if individuals are wearing masks, and that's required anyway, then they can presumably gather in excess of 25 to attend or participate in an essential function. However, you need to qualify as an essential function in order to have the opportunity to exceed that 25 individual limitation. And it gets even more confusing if we're talking about a typical workplace. What's a multi-room workplace? Is the limit 25 for one specific room, or is it for an entire facility? A logical interpretation would be one specific room. But again, that's another example of a very fact-specific type of a question that it's difficult and dangerous, frankly, to generalize upon without having all of the precise details available. And certainly, we would want to have the actual executive order available in order to make a determination. What we've seen happen in West Virginia is the governor's office will issue an executive order, and then the relevant agencies will begin to issue guidance regarding the more nuanced details of that executive order. And that process is likely to replicate itself, because we've already had limitations on the number of people who can gather, except in essential situations in the past 4 or 5 months. We'll need to see whether or not the guidance that ultimately issues is in conformance with that. Haley, any other input on that?
No, but I did check this morning, and like we said, there's no order available, but the announcement posted online does say the limit is purely for social gatherings, which makes me believe then that the business organizations would be exempt from some of the concerns that Mark just articulated. But like I said, without the actual order, it's hard to know what is the actual effective definition of that. But relatively speaking, the presence of masks or not does not affect the size requirement from the executive order, at least not as it's been phrased currently. Regardless of whether they're wearing masks, as long as they meet the restriction, they still can't have 25 or more people.
But recall, the governor's already issued the mask wearing requirement, which is limited to indoor situations where the individuals can't socially distance. So the mask wearing, I think, is pretty much given. Brian?
We had another question just pop in, and Haley touched on this earlier with the locations and sort of determining a hotspot. The question is, are there best practices or guidance with travel to the southern states and back? Lots of vacations to Florida and such right now where there are certainly high numbers of cases. So, is it testing, isolating? What's the procedure?
Unfortunately, there hasn't been a ton of guidance on this from West Virginia on a federal level. People have probably seen that states such as New York are now putting in mandatory quarantines if you're coming from certain states. West Virginia hasn't done that yet, and the federal government is not requiring that yet, which unfortunately leaves just a lot of this up to employer discretion. If you feel comfortable with those people traveling to those places and which places you would feel comfortable with is something that I think each individual employer is going to need a risk assessment of. One of the things that I would do if I was drafting one of those policies is I would find some tangible number or some tangible ratio to determine what is a hotspot and what isn't. Almost every state and county is now keeping track of COVID cases and positive test results. So some of that is easy to find, and most of them report it as per capita numbers. So however many cases there are per capita in that locality or in that state can be a really useful tool for defining within your policy what you consider the thresholds. If that's 10 cases per 100,000, or if that's 34 cases per 100,000, or 100 cases, that to that extent, that is slightly your preference. You can certainly use the places that have been designated hotspots by the governor or hotspots within West Virginia if that system is available and you think that's going to work for you. Otherwise, you know, you look at the statistics and you think Florida is, you know, concerning, but Georgia isn't, as long as that's rationally related to numbers, I think that's fine to do. And certainly if you want to be very conservative with this and you want to, you know, prohibit out of state travel or travel to any state that has over a certain amount of cases, even if it's just a certain city within that state, that's something that you're able to do.
Thank you. Well, at this time, I don't see any other questions or hands raised at the moment. Unless any pop in right now, I certainly appreciate both of you coming on today. This was most helpful, a lot of excellent information provided. So Mark, Haley, I really appreciate you both doing this. What I'll just go ahead and say for the benefit of those attendees right now is if you think of another question right now that you haven't asked yet or haven't had a chance to, go ahead and email that to me. My email address is bdayton@wvchamber.com. Again, that's bdayton@wvchamber.com. So with that, Mark, Haley, was there anything you wanted to close with?
We're very grateful, Brian, for the invitation to participate in this webinar this morning. We're grateful for the attention and the excellent questions we've received from those assembled, and we are hopeful that these types of webinars are going to be absolutely unnecessary in the very near future. Let's all pray for that.
Well, absolutely. Mark, Haley, thank you again. And with that, we'll go ahead and conclude this.
Thank you, Brian.